Go.
Hi, I'm going to be administering cloxacillin via SIVA to my patient, so I'm just going to be doing some hand hygiene here. I already pulled out my vial from Pyxis and I made sure that it was not expired and it's in good integrity. So I'm going to do my first check. So Aero LA, that's my right patient. They're allergic to morphine. The right drug is cloxacillin, which I have here. The right dose is 1 gram. And I have a 2,000 milligram vial. It's going to be given IV for 6 hours via SIVA, and the right time is now. So I'm just going to check my parenteral drug guide. And cloxacillin antibiotic, it can be given by a student nurse, so I can give this. The single max dose is 2 grams, and mine is only 1 gram, so I'm good. I'm going to be reconstituting with 6.8 ml of sterile water for a final volume of 8 for a final concentration of 250 milligrams per ml. And just some side effects with this, because it's an antibiotic, they can get diarrhea, nausea, they can have like a hypersensitivity reaction. And because it's SIVA, I'm going to check my SIVA's chart. So cloxacillin 1 gram, I'm going to need 50 ml in a 60 ml syringe, and I'm going to have 46 ml of normal saline, running normally for 39 minutes. So I am just going to start by cleaning my sterile water vial for 30 seconds, let it dry for 15, as well as my medication vial, 30 seconds, let it dry for 15. I'm going to get my 10 ml syringe, maintain sterility, and a blunt fill, and I need to reconstitute my medication with 6.8 ml of sterile water. So I'm going to pull up 6.8 of air, inject it into my sterile water vial, okay. Oh, so I took out extra, and I'm just going to maintain sterility. I'm going to pull back and just get my air bubbles out, and then I would just go over med waste. Right to 6.8. 6.8. And now I know that this is still sterile because I cleaned it and nothing touched it. So I'm going to inject my 6.8 ml of normal saline into here. And I'm just going to let the air flow back out. So now I'm going to roll my vial, just gently till it dissolves because we don't want air bubbles. I'm going to re-clean it in case my hand touched it. Clean for 30, let dry for 15, and now my dose is 4 ml because my dose is 1 gram, and this concentration is 250 milligrams per milliliter, so the math is 4 ml. So 4 ml. And I checked the expiry date on my sterile water as well, and it's okay. And I'm going to pull up my 4 ml. Okay. Perfect. And again, I just grabbed extra. And I'm just going to pull back, get all my air bubbles out. And again, over med waste, I'm just going to recalibrate to no air bubbles, perfect, to 4 ml. And then I'm going to do my second check with the vial. So I have the right patient that I wanted, Aero LA, cloxacillin, right drug, and that's what I pulled up. 1 gram, which is equal to 4 ml, and that is what I pulled up, and this vial is 2,000 milligrams, so it's okay. Every 6 hours, IV, and this is an IV vial, and we're going to be giving it now. So now I need to reconstitute this as per the SIVA chart in 46 ml of normal saline. So I'm going to take my 60 ml syringe, swing it back, take another blunt fill, maintain sterility, and I'm going to clean this. clean it well for 30 seconds, let dry for 15, and I'm just gonna pull up my 46 ml of normal saline. So I've also made sure that normal saline is compatible with the drug I'm giving, or that's already running in the primary, sorry. Okay, and again, I would just take extra, and then, there we go, maintain sterility. I'm gonna get all my air bubbles out. Okay, and I'm gonna go over med waste again and just recalibrate. And it's just normal saline. 46 mLs. There we go. So now I can mix my medications. So I'm just going to pull back on my syringe. So I need to make room for about 4 mLs. And I'm just gonna remove this. I'm gonna take my medication and just take off the cap, maintain sterility. And I'm going to inject my medication into here. So this is just going to be sharps at this point. And I'm going to prime this. Make sure I get all the air bubbles out and see a bleb of medication at the top right there. And I'm going to put on a blue cap. There we go. Okay, so now I'm just going to stick my label on here at a point where it's not going to include the numbers. So this just says that I have cloxacillin. The dose is 1 gram. It's 4 ml volume. The diluent is 46 ml of normal saline. The new concentration is 20 milligrams per milliliter. And today's date, time, my signature, and designation. So now I'm just going to get tubing and some alcohol and my flush and my mar, and I'm ready to go to the bedside. So go to the bedside, knock, knock, knock. Hi, Mr. Ellie, my name's Susadhi. I'm gonna be your student nurse today. I'm gonna do my safety check, make sure everything's okay. Can I just check your wristband here? So first name, last name, date of birth, and I see they're allergic to morphine, which as it says on here, allergic to morphine. So I'm just gonna check the IV site, no redness, no swelling. Is there any pain here? No, you're okay? Good, okay. I'm just gonna check my primary as well, make sure it's running, no kinks in the tube, everything's good. I'm gonna do my third check. So I'm gonna compare my label to my MAR. So I have the right patient, I already checked. The right drug is cloxacillin, 1 gram IV, and I have 1 gram, which is 4 ml in here, and this is gonna be given IV SIVA every 6 hours, and the right time is now. So now I am just going to tell my patient, okay, Mr. Ellie, this is your cloxacillin, this is your antibiotic. So I just want to give you a heads up about some side effects. You might feel a little bit nauseous, some diarrhea might happen, and you might have a hypersensitive reaction to it. So just let me know if you feel any of those things, okay? The call bell is right here. Okay, at this point my patient would have the right to refuse. They're not refusing, so I think it's okay. I'm going to prime my tubing at this point. So I'm just going to take it out. And I already labeled my tubing so the next nurse knows when this tube was started and who started it. So it just has today's date, time, and my designation on it. So what I'm going to do is just take off the blue cap. And like I said, I already ensured that this is compatible with my primary that's running. There we go. I'm just going to hold it like this, and I'm going to just make sure that I get a little bleb of medication. And there we go. Okay. So now I'm just going to take this down. I'm just going to ensure that I'm just oops. There we go. Make sure that you can still see the numbers on there and the label. I'm going to move this down. I'm going to reattach this. Okay, so now I'm just going to use the closest to my patient because I know that he's not going to be getting any push medications and I don't need the IV pump to regulate it. My SIVA is actually going to do that. So I'm just going to swab this really well. 30 seconds, let dry for 15. And I'm going to take off my maintain sterility. There we go. Okay, and I'm just gonna wait with my patient, make sure they don't have any reactions right away. And I'm gonna start. So the time is now running 2 and the light's on. So like I said, I'm gonna wait with my patient because of the hypersensitivity reaction, especially if it's his first time getting it, and make sure he has no reactions. And then I'm going to head out and make sure that I do my safety check. My patient is okay, the bed is low, call bell is within reach. I'm just gonna come and sign my MAR with the time, the date, my signature and designation. And then I'm gonna check on him periodically, but after the medication is finished, I'm gonna go back in with a 3 cc of normal saline flush and put it in my SIVA and make it run at the same rate as the medication because I want my patient to receive the entire dose of medication at the same rate as well. And yeah, that's it.